Hello, I'm Dr. Asit Arora. I'm the Principal Consultant and Chief of GI and HPB Oncosurgery at Max Super Speciality Hospital, Saket. Today we're going to talk about pancreatic cancer, its risk factors, its symptoms, and the treatment of pancreatic cancer. So let's begin with what is pancreas. So pancreas is an organ which is situated in the upper part of your abdomen beneath the stomach. It is located transversely just over your spine. Now, pancreas has two main functions. One, it secretes insulin and it helps in regulation of your blood glucose levels. And second, it acts as a secretor of digestive enzymes and helps in your digestion. Pancreatic cancer is one of the commonest cancers of GI tract that affects the human body. And unfortunately, even after so many years of research and advances, it still remains one of the lethal most cancer in the body. Pancreas is usually divided into various parts. One is the head of the pancreas, then we have the uncinate process of the pancreas, and then we have body and tail of the pancreas. So when cancer arises from the head of the pancreas, it can lead to symptoms like jaundice, which could be the initial presentation in many patients. It can also causes anorexia, distaste to food, and weight loss. It can lead to pain, which usually is in upper abdominal pain, and then this pain can radiate to the spine. And in late stages, it can also lead to bone pains and pain in your upper abdomen and distension of your abdomen due to accumulation of fluids. Pancreatic cancer can have various risk factors, and most common of them is one, smoking. Second is excessive intake of alcohol. Obesity and lack of physical activity is another important risk factor. Then certain hereditary conditions like hereditary pancreatitis, or if somebody is suffering from other genetic disorders like familial adenomatous polyposis, these patients are at higher risk of pancreatic cancer. If in your family you have had first degree relatives who have had pancreatic cancer, then one is at higher risks. If you go to a specialist with the suspicion of pancreatic cancer, the test that you are usually asked for is a CT scan or a PET scan, which we use to detect the staging, local staging, and the distant staging of the pancreatic cancer. One of the very important issues about pancreatic cancer is jaundice. So jaundice is a symptom of pancreatic cancer, but at time we have to treat this symptom before treating the cancer itself. So if jaundice is more than a certain threshold, then we put in a stent to decrease the bilirubin levels. But certain patients think that treating jaundice is actually treating cancer, which is not the same. So I urge that you don't fall into this fallacy. We are treating jaundice just to enable us to treat your cancer better. Now, most important in any cancer, but more so in pancreatic cancer, is that we should detect these cancer in the nascent most stage. Earlier we detect it, the better is the prognosis and the treatment options of these cancers. So as soon as you have any of these worrisome symptoms that I've described, you should consult a specialist and seek medical advice. And once your staging is done, your CT scans and PETs have been done, so once we have finally come to a conclusion like what stage this cancer belongs to, the specialist will advise you for, if it is an early stage cancer, it will be treated with surgery. So surgery will entail the removal of the part of the affected pancreas. So if it is in the head of pancreas, a surgery which we call as Whipple's pancreaticogenictomy is done. Now this surgery is traditionally been done by open approach, but now of late in past few years, this surgery can even be performed laparoscopically. Most of these cancers will require addition of chemotherapy and at times of radiation after surgery. But if you detect cancer a little late, it has spread outside of the pancreas to the adjacent organs, then we might have to give chemotherapy prior to surgery to downstage this cancer and then operate. And in late stages, in which we call as a stage 4 cancer, in which cancer has spread to the other parts of your body, say liver or lungs or other areas, then unfortunately patient can only be treated with chemotherapy, and then intent is only palliative rather than curative. So this cancer is fortunately almost 1/3 to half of these cancers are preventable. So if you can avoid the risk factors, naming smoking and alcohol intake, and you can control your obesity and be physically active, a significant proportion of pancreatic cancers are avoidable. So I suggest all of you to indulge in healthy lifestyles and seek urgent medical advice if any of the risk factors that I have mentioned are present in any of you or your loved ones. So if you have any questions or queries related to pancreatic cancer, please ask your questions in the comment box. Our team of experts would be happy to answer any of your queries, and kindly share this video for further circulation. Thank you.